of the approach that we used. And by critique, I don't mean picking out negatives, but objective analysis of how we responded to the COVID-19 pandemic. And we look at mainly issues of compliance and how they can be improved. A bit of the situation analysis. The data we used then at the time of writing this brief and doing this review has long been adjusted, we can say surpassed by time. So there was a need to revise the situation analysis specific, to do a situation analysis specific to this presentation. And we make few observations that the spread, that the infections keep fluctuating, and that the cases have over time risen. We are now at one point on 17th July, when the president intervened, we had shot to 1,584 cases. But that has since dropped significantly to 234 confirmed cases as of July 26th. And we see it going, we see the curve going down, threatening to reach the flat level, which implies the positive impact of the lockdown. But we shall discuss this in the subsequent slides. I need to mention that these figures are coming from credible sources, Johns Hopkins University, where they working in liaison with the Ministry of Health. They keep updating Uganda's data, and this same data can be found on the new, there's a COVID-19, when you go to the Ministry of Health website, there's a COVID-19 window that you click, and it gives you this bit of this. I don't need to repeat, but just mention the percentages because these are more striking. It's interesting to note that over time, cumulatively, only 3.3% of our population has tested for COVID. It's also very interesting that the recovery is very high, contrary to what we have been told over time, and the image in the public that COVID is such a vicious virus. There's some good news that is not projected in communications to the public, that there is an 80% recovery, which means that most of the people who fall sick do not actually succumb. And the deaths are only 2.7%. What is also interesting is that we have only covered 2.5% of the population in terms of vaccination, and these are not fully vaccinated. The fully vaccinated, who are only 4,129, are below 1%. So they are actually is a terribly small number that is worrying. There are issues we are going to discuss around this in the subsequent slides. We observe that the infections have long spread from the controlled areas like hospitals, as it was in March 2020, to the community. Now we are among the countries with the community level infections. Although we observe that the infections, the number of new infections is fast dropping, we think that there are still many issues which are visible in our public to do with non-compliance with SOPs. And this is worrying because as we continue, we need community compliance for us to succeed in containment of this pandemic. Allow me to mention an academic element that the methodology for compiling data on this paper that was done June 2020 to September 2020 was largely by document review. And we looked at studies that were conducted, reports that were done for this and previous outbreaks of viral infections like Ebola, Marburg, and all that. It been thoroughly addressed by scholars at the time we conducted this study, but a lot of data has emerged, which we have used to make some of these assertions. Interestingly, World Health Organization had projected that about 40% of patients with COVID may have mild disease. That is fall sick, test positive, but not fall sick as in to require admission. And they also predicted that about 40% of patients with the COVID-19 may have moderate disease. That is the inpatient, that is may fall sick to the level of admission. And that 15% of them would have severe disease that requires oxygen therapy and other inpatient interventions. And 5% of these would require critical disease, including disease management, including mechanical ventilation. So this scenario connotes low mortality, that the deaths would be low, the mortality would be low, but projects a high debility potential, and that is the illness to admission that has capacity, in our case and in many developing countries, to overwhelm the healthcare system. So we need to know that the concern, the worry, is not so much about the sickness and the deaths as it is for the breakdown of the healthcare system, including what we would need to treat other illnesses. And this was projected by the WHO then. And in the Ugandan context, we almost came to this. At least we have witnessed this so much in the second wave, where people are looking for oxygen and could not find it, all these things. And that's why prevention is the emphasis in most of these interventions. And we also found that practitioners were worried about scarcity of essential equipment, especially in relation to the heightened cost of treatment and disruption of treatment schedules. You can imagine having an influx of COVID-19 positive patients in a facility that has limited ICU beds, limited resources. So, and this equipment was not, the necessity for this equipment was not foreseen before the pandemic. And countries are still grappling with this concern in terms of procurement and resource management. The likelihood of hitting unmanageable figures was not far-fetched, as we have seen in the second wave. This calls for more heavier interventions. Then there's a very big concern that behavior change communication strategy remains conventional and deficient of the required enhancement is to cause the population to appreciate these unconventional interventions like wearing masks, like social distancing. These are things that the population is not used to, and the Ministry of Health needs to adjust its communication strategy to now integrate the concerns of the population. How do you now revise this, your usual communication approach? And then how do you introduce population-specific communication so that access to information on this illness and normalizing the new norm, what we call the new normal, is addressed. We need to document influences of health-seeking behavior at community level, grassroots level. Social network analysis done by a number of scholars, including scholars like De Vries on community health, resource mobilization for poor communities, have indicated that populations listen more to the influencers at their level than us, the health workers, when it comes to these unconventional behavior requirements. So integration of clan leaders, local leaders, elders at grassroots level is key. Outside the structure that we know, which ends at the VHT, the VHTs, there are other influencers on the ground that we identified when reading this literature that need to be considered. So the grassroots health actors are minimally supervised and minimally trained. When you give a VHT a telephone to use for toll-free population communication with the health system, the usage is different. The understanding of the population of the VHT changes immediately. They are facilitated with this. This is according to Turinawe in 2018. The population considers VHTs as part of the healthcare system, and that is also a concern in time for us who want to manage behavior and prevention of COVID-19. So here I'm in these two bullets, I'm talking about participatory intervention so that the population owns what we introduce. Key issues continued. We observe that public compliance with the edicts introduced by Ministry of Health were complicated by minimal public knowledge of the illness. Awareness was not adequate. The incredulity of prevention measures unheard of in the immediate epidemiological history of Uganda threatened this compliance more. People were seeing for the first time militarized interventions, which are actually catered for in the Public Health Act. There is an appreciation of not military, I'm using military in terms of coercion, not the military guns, but coercion, as we saw it with the LDUs. And in other countries like India, where resistant populations that could not be required intervention by the military and other forces. How it was done, the response, the social response, and whether it helped needs to be studied, especially in consideration of one of the interventions that I'm suggesting in this study. We also observed an emerging social resistance due to perceptions introduced in the population by spiritual, sorry, I put church here, but it should be spiritual actors who firmly communicated that COVID-19 was not real, that it was a figment of WHO and other the health actors' imagination, the social media, and locally here we had some people thinking that the interventions were politically motivated, which also caused a bit of a problem. But that we group all that in social resistance. There are issues to do with social dynamics, a threat to livelihoods. The intervention threatened many livelihoods, many of which thought they were closing temporarily, but actually closed permanently as people shifted from teaching, from some professional courses to informal livelihoods like boda riding. And of course, there's the usual fear of poverty that led people to move. We also observed that there is a complex distribution of relief items to the vulnerable populations, which would have come as a compensation for the loss of livelihoods, temporary loss of livelihoods, and assurance of care by government. And these were complicated by lack of system and lack of prior arrangement. You can be soft on government in this scenario because they were addressing this issue for the first time. But it also speaks to our systemic preparation for issues like when we talk of a Ministry of Disaster Preparedness, what are we talking about? And when we talk of the Public Health Act and possibility of pandemics, possibility of these epidemics, outbreaks, what are we really talking about when we get ambushed like this? So there is there's an element of complacence that these African governments, governments in the developing world inadvertently subjected themselves to by focusing on chasing the world and not preserving budgetary provisions for events like these. There was alienation of community level influence, that's already mentioned, and a new emerging issue of regulation of innovations during these pandemics. It's not the first time that local, or let me call them alternative healing systems, attempt to provide solutions to management of illnesses and disease. You remember very well in the HIV times of when AIDS was really vicious before the advent of ARVs. You remember people like Nanyonga, people like Lukwago, who claimed to have healing, to have treatments that would address opportunistic infections. And I thought we would have known how to manage such by now. And now our pharmacists have taken on proactive intervention by investigating herbs and innovating treatments. But from the Professor Wang experience, it seems we were not prepared in terms of policy guidelines, in terms of patents, ownership, and all these things. And it had to be the president to sort this out instead of the law. And these being professors, if the law was in place, would not have had that drama that we saw in the newspapers. So regulation of innovations is critical as one of the lessons we pick from this pandemic, from the way we managed this pandemic. We observe that interventions by government, especially these lockdowns and other regulations, we saw that the Ministry of Health has introduced rules on management of COVID-19 as a supplement to the Public Health Act. But these are, we say they were timely, they achieved the desired short-term public health objective of reducing infections and deaths, but they are deficient on sustainability because we need to ingrain them in the law rather than regulate them, relegate them to rules and all these. So we also observe that World Health Organization projections on mortality and morbidity in the case of Uganda have not been reached, mainly because again, Uganda is super at management of epidemics and pandemics, because whereas WHO talks of 5%, the mortality, as we saw, is at 2.7. Whereas WHO was talking of morbidity of 40%, our morbidity is still very impressively low. We are talking of the highest. This call for continued vigilance, and so that we don't appear like we were only lucky. The existing policy framework is inadequate to address the far-reaching cross-sector implications. As you saw, we observed an interaction of hitherto unrelated sectors of government to manage the COVID-19. You had the security coming in to manage a health issue. You had the Minister of Gender being a key actor in this. You have Minister of Health, of course, at the center of it. You have now these unconventional practitioners coming to work together, and the potential of collision and negative energy is very high, or what people have previously called uncoordinated movements, troop movements, is very high in such a scenario, and it needs to be regulated by policy. Who does what, who does this, and how do we merge when things change? It's therefore imperative that government revisits existing policy framework to exhaustively address these policy gaps. What do we recommend? We suggest humbly that Ministry of Health should pursue legislative support to review the Public Health Act, specifically to establish minimum budget allocation for management, of outbreaks and pandemics. Ladies and gentlemen, you observe that absence of adequate resources affected efficiency, effectiveness of our interventions. We need to respect, I think the Ministry of Health, you've heard from previous scholars and actors in the sector, that the Ministry of Health has hitherto been underfunded. And the pandemic has caused a bit of increased funding, but we need to ingrain it in the policy document to say government at any moment should spend this percentage of its budget on the health sector, including consistent provision of funds to address an emergency in case it happens, whether it happens or not. Funds not used can always be returned to the treasury and returned to the sector. And they should be availed to be utilized in time, because in this case, you have funds being mobilized as the illness, as the pandemic continues to take people's lives. You have an example of the recent intervention, what people are calling the Nabanja funds. We are coming to the close of the lockdown, and people who got the money got it only a few days ago. Had this money been part of the funding that I'm talking about, it would have been disbursed early enough, systematically, and nobody would be complaining. We need, in consideration of how the forces behaved, the losses that the lives that we lost, which were not lost to pandemic, but lost to bullets and beatings by untrained soldiers and police, the forces that intervened, LDUs. In view of this, because some militarized intervention is many times necessary, we are suggesting that government establishes an social emergency management force trained to handle the sensibilities of social issues of communities at times of pandemics like these. You need you need forces that will understand that a pregnant woman does not have to have a bulging stomach all the time. That a person can be pregnant and not having a bulging stomach. You need forces that can appreciate that optical illnesses do not cause bleeding or swelling eyes, so that people can be allowed access to healthcare services and other social amenities that are allowed in the circumstances. We also need to define vulnerable communities for procurement and delivery of relief items in emergency situations, looking at flexibility in PPDA, and if it can't be adjusted, then we pre-qualify suppliers of this kind of services earlier or in time, because we never know when the pandemic is coming. So these are systemic issues that need to be addressed. And we need to support population-based surveillance system so that the conventional health structure from the ministry headquarters up to the health assistant at the parish level and the VHTs can communicate with equal knowledge, especially of social issues. For example, at grassroots level, VHTs, I can tell you, because I'm interacting with them regularly, VHTs require more knowledge than they have about COVID-19. We need to regulate processes, ownership of innovations for prevention, so that where productive, useful innovations have been made, they are not again hampered by traditional or unforeseen barriers, technical, legal barriers. So this needs to be well documented in the Public Health Act, especially that element that was recently introduced on management of COVID-19, but also other potential pandemics. You have to ensure that there's equitable population access to information, IEC materials. In a recent study we conducted in Kisoro, we observed that the Batwa community, there was no unique approaches to unique needs of some populations like the Batwa community, where English materials, IEC materials in English were distributed to Batwa, and they were only using their appreciation of pictorial images to imagine what the IECs were communicating. We think this needs to be improved, including use of languages. We need to invest in linguists as a sector of health. You need to invest in linguists so that they communicate effectively these IEC materials. We need to prioritize protection of health workers during outbreaks. The current debates on PPEs is a bit sad, where you have health workers getting infected because they don't have adequate PPEs. But that is not actually the biggest worry. The biggest worry is that when they get the PPEs, do they use them? There is also need for training health workers to use these PPEs. So how do we at policy level ensure that? I think the manuals should be revisited from the ministry, that go down to the health workers from the ministry to enforce supply and use of PPEs at facility level. You observe that we lost some doctors. Of course, we don't have a documentation of how they got infected and all that, but we need to do what we can for them to be protected. We coercion, I've already mentioned this in a suggestion to establish a well-trained social emergency management force.
Request you to be.
I appreciate your time. I appreciate your attention, and I look forward to your contributions, ladies and gentlemen. Thank you very much.
Yeah, thank you very much, Mr. Jude, for that enriching presentation. It is packed with a number of issues for reflection. For instance, from your presentation, we learned that we have only tested 3.3% of the population. And then we also not seeing something positive that 80% of recovery rate. We don't know for whether because of good healthcare or Ugandans are taking care of themselves very well. We also note that there could be policy gaps that need addressing and so many other things. But at this juncture, because of time, let's invite Secretary General David Lewis Rubongoya of the National Unity Platform to make his submissions. We are giving him about 20 minutes, and then thereafter we shall invite the Minister of Information, Communication and National Guidance to give a government position. So at the moment, I take the opportunity to invite Mr. David Lewis Rubongoya. You are welcome, sir. Mr. Rubongoya, please unmute your microphone. We see that you are muted. Thank you.
Okay, thank you very much. I've been trying to unmute myself without much success. I hope now you can hear me, and a good afternoon, a good morning to everyone. A few minutes to the afternoon. Are you able to hear me?
We can hear you well, sir.
Yeah, I want to first of all appreciate you for the invitation, but also to appreciate the presenter for the job well done. Thank you, Mr. Jude Remisisi, and of course, Dr. Werike, and everyone else on the on this platform. I think the presentation was definitely enriching. My name is David Lewis Rubongoya, and I'm the Secretary General of the National Unity Platform Party. Before I say anything, I really want to, and every time I get an opportunity, I pay homage and appreciate, especially the health workers in this country who have had to, be at the front line in this fight against the pandemic, which is unprecedented. And of course, as has already been pointed out, we have a kind of unreadiness to handle this pandemic, and but we've seen our health workers work very hard going through all these challenges to be able to see that they help us deal with the pandemic, and in the process many of them have contracted the virus and some have died, so we must always get every opportunity to appreciate them. I will just use a few minutes to talk about what the National Unity Platform thinks has gone wrong in our response, maybe what has gone right, and also make a few recommendations. And given that we have very little time, I want to focus on a few things. The first one is healthcare. NUP has been constantly, talking about some of its core agenda points as healthcare and education, because we know that if you do not invest in healthcare, then you do not have a productive population, then you have a sick population, then that, brings many other challenges in other sectors as well. But we've seen this government, the NRM regime, continue to spend little money on healthcare as compared to things like security, as compared to other things which they think are very important. But we have been constantly saying that the funding to healthcare should be increased. In 2001, African governments agreed to devote 15% of their GDP to healthcare, and that was through the Abuja Declaration of 2001. You see several governments on the continent try to, meet that threshold, although I must admit that not many have been able to. But in our case, you don't see any effort to increase substantially the funding to the healthcare. And I think that's very, very problematic. If you, for example, see how much you spend on healthcare vis-a-vis how much we spend on security for a country that's not at war, for a country, you know, you move around this country, and I'll just give a simple example. During these campaigns that just ended, you would go to almost every district of this country and find new police trucks, police officers bearing new guns and all that. But then you look for an ambulance in the district and you don't see any. Here in most of the districts, you see individual members of parliament and other politicians buying ambulances for the people. If you look around, the biggest number of ambulances in this country are private. But then if there's any problem, political in nature or something like that, you'll see all these new, brand new double cabin pickups full of new military gear coming to disperse people. So we think that there must be a deliberate effort to spend on healthcare. And if we had not learned that lesson before, I think now is the time to learn it with this pandemic, because I think what the pandemic has showed us, first of all, is that all of us are affected equally by a poor healthcare system. For a very long time, we've had different classes of people thinking that they are not prone to the problems of a poor healthcare system. They can easily afford to go to Nairobi or to go to India for treatment. But this pandemic has showed us that, look, what we are in is for all of us. And so the political class must now wake up and see that we invest enough money in healthcare. And of course, related to that, you see, we've been talking about PPE, oxygen, and the challenges we've been having to access sufficient oxygen for the patients. Recently, the Twaweza, an organization, did a report about the testing in this country and why people are resorting to use to these herbal medicines, all sorts of concoctions. You see, you've just been reading out the figures, and they are sickening, to say the least, that we are over a year into this pandemic, and we're talking about only 1.4 million samples tested ever since the pandemic started. What that means is that majority of the people of Uganda have actually not been tested, and many people resort to, you know, self-medication with all sorts of concoctions, and then they go to pharmacies and get whatever drugs are there. So it is extremely unfortunate that that's what we have. I think, and I mean, every citizen knows how expensive it is to get tested in this country. The free testing in public facilities is accessible to only a few people, and majority of the people who decide to go to private facilities, according to the report I was talking about, the Twaweza report, you have to pay about 80,000 shillings for the rapid test and about 250,000 shillings for a PCR test. Definitely, the majority of the people of Uganda cannot afford that kind of money. So I would expect by now the government in this country to make sure that there is testing. I mean, in other countries, you just walk into a pharmacy and you find that you can be tested for COVID. Because if you do not have people tested and then people do not know their status, then everything, these statistics we are reading are really, in my view, not very accurate, because how do we know how many people have been tested? How do we know how many people have actually succumbed to the virus when very few people are tested, only a small fraction? So I think we definitely need to focus more on motivating the health workers, ensuring there's PPE. Recently, it was just shocking to see that even just allowances, meager allowances to health workers were not being paid. And then what I saw was the government saying, you know, you keep working and we'll give you this money as in form of areas. But we're talking about medical workers who sometimes cannot even afford transport to even go to their working station. Away from that, the response to the pandemic was initially proper because, for example, we supported the first lockdown. But what we later saw was that, like in many countries on the continent and elsewhere, where they have what I would call hybrid regimes, COVID also became an issue of double standards, and it was politicized. And I will tell you that right after the first wave, we saw COVID only real in the context of politics and not elsewhere. And we used to debate this a lot of times, that you would see Chikubo is open, churches, people are going to churches and everything. People are everywhere. Towns are full of people. But then the government would say, because of COVID, you're not allowed to have public rallies, public meetings, etc., etc. And that became a problem, in my view, because then once the pandemic was politicized, I think many people even stopped taking it as serious as it was. And of course, that led us into another wave, which has proven even more difficult. So I hope that the enforcement of SOPs can cut across, and not the double standards that we saw definitely should not be there. But also, we've talked about the question of enforcement of these SOPs. You do not have to be extremely brutal and violent. And you know, the first wave, and you remember how many people we lost, how many people died. And even in this one, you've seen police shooting people and killing them. So it's really, really unfortunate that sometimes the state has to use excessive force, violence, to enforce the SOPs. And I think that also is born out of a lack of a plan, a clear plan. You just wake up one day and say, now we've announced a lockdown without clear measures of enforcing it, without clear strategies. Many Ugandans know that even after General Museveni gives his speech about these the measures, people will tell you that we've not understood these things. Now we're going to LDUs, be the ones to interpret them for us, because there is not a very, very clear plan. So you find that whoever is interpreting the measures put in place are the LDUs that you find. And of course, many of them, the security officers in this country, have used this as a measure of extortion from the already poor people. The third thing I want to talk about is definitely the prioritization. That's related to the first one, the healthcare. But we saw this right even from the 2020-2021 budget, which came in the midst right after we had had a lockdown and all that, and the minister then called it a COVID budget. But if you look at the figures devoted to the healthcare, for example, there was no big difference from the previous budget. So the government has not prioritized this pandemic in as far as the allocation of resources is concerned, and that is definitely not right. We have seen, of course, we're going to have a shortfall in government revenue. We've already seen that, but related to that, increasing of the debt burden. Now, if the public debt is increasing and the government revenue is reducing, why don't we change our priorities? Many Ugandans have been shocked that in the midst of this pandemic, the government is releasing 200 million shillings for each member of parliament to buy a vehicle. And should that be a priority at this particular time? And of course, as NUP, we've put out a statement and clearly indicated that we're not in support of this, and have encouraged our members of parliament to devote most of this money to public services, which should ordinarily not be their function. It should ordinarily not be their role. And as a party, even right now, while I'm in this office, people are just here, people looking for food and help and that kind of thing. But I think that the resources of government right now should all go to not to buy a new convoy for the president, not to do what, but to help our people, cushion our people. You look at the figures spent on these vehicles that I'm talking about, but unfortunately, Ugandans have tended to focus more on these vehicles and not look at the wastage of public resources across, with foreign travel still reflected in our budget, with huge amounts going to security again, with all these kinds of things, and which we call wastage of public resources. So we think that there should be, if possible, if need be, and one of the recommendations we're making should be that the budget should be reviewed. The budget for this year should be reviewed, should be revisited, such that it focuses on the welfare of the people, it focuses on healthcare and such other things. Maybe the other thing I should talk about also is the question of the public debt is definitely very worrying. We're just going beyond the 50% threshold. by December last year, we had hit 65.82 trillion shillings in government debt, in public debt, and that should worry everyone because we have very, very many more years to pay this amount of money. But the question is not even just the public debt, but mostly what this money does. I will not go into the reports of corruption in terms of, because the government will say, oh, we are spending a lot of this money on roads and whatever. But then when you look at how much money we lose, even in those sectors themselves, it's just incredible. I'll talk about accountability a bit. The Auditor General's report last year was very clear and vivid. And please note that the Auditor General did not even did not audit the entire expenditure of 4.683 trillion shillings that was spent on the response to COVID. The Auditor General only audited 311 billion shillings and unearthed a lot of corruption, and asked some of the issues that we're talking about, flaws in procurement and everything that went wrong. What is very unfortunate is that some of the people who are implicated, there has been no action taken on those individuals at all. In fact, we've seen some of these people reappointed or even promoted to higher ranks. In other countries, including here in Africa, in Malawi, you saw a president cracking the whip, sending away some ministers, the Minister for Labor and other government officials who were behind the theft and the corruption or the embezzlement of public funds meant to tackle the COVID-19 pandemic. But in this country, there has been no accountability. The Auditor General makes a report, it is put on the shelf, we move on to something else. So how can that, how can we say that the government is interested in ensuring accountability? Finally, I'll talk about the interventions. Honorable Waliomusi has been, very active in the press talking about the 500 and something thousand people who the government was targeting to give them, some, the 100,000 shillings. First of all, this is very, very little money by all standards. But even that money, to target over 500,000 people, slightly over 500,000 people is a big joke. In this country, over 8 million people live below the poverty line. Majority of these people live in rural areas. But the government effort was mostly targeting people who live in urban centers, urban areas. And the result of this, people are living in very, very dire situations. Children are getting more malnourished, a crisis that we have to deal with for very many years. You have communities like the Batwa that have been talked about, communities that have been marginalized for a very long time. And then you also have people, for example, in northern Uganda who are dealing with the nodding syndrome and that kind of thing. So it becomes extremely difficult to convince anyone that you should give 100,000 shillings to just slightly over 500,000 people. But even then, I do not know how many of these people have been reached, because we've seen many people registered actually have not been able to get this money. And every time we operate here in the ghettos, and you don't hear people tell you that they actually received this money. And I mean, even then, I saw the minister the other day say, oh, there were some technical errors, some people got paid twice, and this explains whatever. And that becomes a bit problematic. We think there should be clear planning. And all that we see is different agencies, the lack of planning on one agency affecting all this, because if you have a NIRA, and if NIRA is doing its job, its rightful work, and you have UBOS and you have all these entities, then they should be able to inform you. And they should be also doing their work on a more regular basis. But if you are to rely on a 2019 UBOS report, when the circumstances of some of these people have already changed. So it's a question of lack of planning and the government in disarray, in our view. The clear lack of any means of social protection for the citizens. Since last year, there have been calls to say that, okay, people who are investing their money with NSSF should be given some little money to help them go through this pandemic and the crisis they are in. But up to now, the discussions have been on and on and on, and there hasn't come out anything from that. So what is the purpose of saving money if that money cannot help you in such a time when you're dealing with a terrible, terrible pandemic. We saw promises made last year. For example, General Museveni made a promise to teachers to say, I think it was 200 billion shillings that he promised them. Up to now, they've not received that money. There was money which was put in UDB to help, apparently, to help poor people. But who was able to access it? The conditions put in place. The government was saying, you know, we need people who are the SMEs which are already registered, which have some form of assets or whatever. And of course, that intervention is not able to help the poor of the poor who it should be targeting. So the interventions are meant to help cushion the citizens against the effects of COVID-19 have not been very effective. So there are very many recommendations we would make. Of course, some of them have already been made by the presenter in terms of the legal reform, policy reform, but most importantly, there must be political will, especially to invest more money in healthcare, to look at our healthcare professionals and workers as deserving of you know, better treatment by the government, and also to see that there is discipline in the management of public resources meant to deal with this pandemic. As we stand now, if no action is taken, the Auditor General makes a report, there's no action taken against anyone for, you know, the wrongdoing, then what we're going to see is a continuous breakdown of the healthcare system. And for me, the scandal of this year, over a long time, I saw when the president was reading figures last time, and he said that we have 218 ICU beds across the country. I found that very, very scandalous. I thought any person, just not even the president or even a minister, should be very, very ashamed to read such figures. When you compare that to other, to where we put the money, to where we invest this money, and you see there are tear gas trucks in every county, in every district of this country, but then you find that you have only 200 ICU beds. It's extremely unfortunate.
Thank you. We have about 2
I thank you so much. And I talked about social protection measures. I talked about revising, the need to revise the budget for this year, having a clear plan by the government, especially for the post-pandemic period. How do we get out of this pandemic? We went into a lockdown without a clear plan, and we are getting out of the lockdown without a clear plan. And who knows what will happen when we have a third wave and all that. So the government needs to come up with a clear plan. And of course, we need to pay attention to the rising fiscal deficit. I thank you so much. God bless.
Thank you very much, Mr. Rubongoya, for that nice presentation. He raises very serious issues, but we are lucky that we have the government in attendance, the issues of investment in healthcare, issues of date, the issues of response to the pandemic itself in terms of interventions, and then the issues to do with the targeted people, the 500,000, and there are also policy issues. If you look at, for instance, the suggestion to review the budget such that it focuses on healthcare and welfare of Ugandans. We also got some messages from participants. I see that why can't we invest into vaccines instead of the Nabanja money? This is a presentation from, sorry, a message from one of the participants. I just want you to know that we have over 800 participants on Zoom, and then on Facebook, YouTube, Twitter, and other platforms that are following us. So at this moment, I'm going to invite the Honorable Minister to have the opportunity of about 20 to 25 minutes to respond. And Minister, I would request you that probably mention some of the interventions that we might not have had, the achievements, and how are we prepared probably for a possible third wave. Thank you. You are welcome, and thank you for accepting to be part of this discussion, sir. Honorable, please unmute.
Thank you very much. Are you hearing me now?
Very well, sir.
So thank you. Thank you very much, Mr. Moderator, and let me take this opportunity to salute all of you and all those who are participating in this discussion. I want to thank the team from the African Leadership Institute and the Uganda Management Institute and all the academicians and the analysts who have put together this report, and we warmly welcome it as government. And let me also thank those who have spoken, including my brother Sisi, who started us off, and also my brother Davis Lewis Rubongoya from NUP, who have just given their very interesting remarks and useful information to us. As I start to give my response or remarks, let me convey my condolences on behalf of government to all the families that have lost their dear ones due to COVID-19, and also thank our health workers who are working day and night to manage all those who are affected by COVID-19, and all the frontline workers, including security officers. Last night, I passed through Dinda at around 1 a.m. And while some of us may be asleep, they are working. So let's not condemn people who are doing their best. And in our various positions, let's do whatever we can to make a contribution in addressing and managing this pandemic. If we choose that our contribution will be criticism, okay, then that will be criticism. But let all of us join hands like you have done to put up a policy, a position in which we can discuss, reflect on, and use to improve the way we are managing this issue of COVID-19 and other public health challenges we have. My first point is to take you back to the history of this disease briefly. I know we have pressure of time, but we call it COVID-19 because it was first identified at the end of 2019. And the scientists in China identified it as a new type of coronavirus. That's why it's called coronavirus disease, identified in 2019, COVID-19. And therefore, it's a new disease which has presented challenges to all sectors of life, whether it's governments, policymakers, healthcare workers. We are confronted with this new disease, and we continue to learn as we manage this pandemic. On 11th March 2020, the World Health Organization declared COVID-19 as a pandemic, meaning it was an epidemic which had reached all corners of the globe, and it was spreading very fast. Just 1 week after, on the 18th of March, the government of Uganda, led by President Yoweri Museveni, came out to give a major pronouncement on the measures which we are going to follow as a country to manage this pandemic. And you recall, we had not yet registered a case of COVID-19. So it shows how prepared and how steadfast the government was, and how it took this issue as a very serious issue. And shortly after, on the 21st of March, just a few days from the president's address, that's when we identify the index case at Entebbe Airport of a young man who was traveling back from Dubai. And I can say Ugandans, by and large, complied with the measures which had been announced, because all of us were panicking as a country. It was a strange disease which began killing people, especially in China, in Europe, in America, in Brazil, and the rest of the world. And we got the first death in July last year. So when we had that first wave of COVID-19, I can say we did very well as a country, and we would like to thank Ugandans for having complied with the measures and for having taken the advice from Ministry of Health, the health workers, the president, very seriously. We reached a point when the curve reached a peak around November, December, but thereafter it sharply came down. And at the beginning of this year, in February, March, thereabout, we even began recording 0 cases of COVID-19. And even when you check the world publications, Uganda was credited as one of the best countries in managing COVID-19. But now we are facing a second wave, and the question is, what happened and why are we where we are? First of all, it's a phenomenon that has cut across the world. Many countries in Africa are actually grappling with the third wave, but because of our correct actions in Uganda, we managed to delay the emergence of the next wave. So we are in the second wave, while majority of the countries are suffering with the third wave. Third wave in the Western world, there are even those in the fourth wave as we speak today. But the challenges were largely two. One, I think some of the actors in the country vulgarized the whole response to COVID-19. You recall there were people who were saying there is no COVID-19. Government just wants to steal money. Others were saying government wants to use COVID-19 as a repressive tool to harass the opposition. And that misled a number of Ugandans to think that we didn't have a very big challenge. And when the infection rates came down, complacency started setting in. You know, when we went into campaigns, there are politicians who defied the rules and said we shall address huge rallies. They campaigned without putting on masks, and that was a very wrong message to the population. And we think that partly contributed to the complacency which we saw among Ugandans. Ugandans stopped putting on masks. The social distancing measures which we had recommended started breaking down. When we allowed churches to open again with few numbers, we saw them getting filled up, buses were getting filled up, and that also facilitated now the transition into a second wave. But I think most importantly, the bigger challenge was the emergence of variants, the new variants, because you know viruses undergo what we call mutation, and then they appear in a new form where now those new strains present with different characteristics. And what we got in this new phase, the new wave of COVID-19, is that we had variants, particularly the Delta variant from India, which is much more virulent, which is more aggressive, highly lethal, highly transmissible. It kills fast. And that's why you saw in May, June, and early July, we reached crisis points where we lost our dear ones, where the hospitals got full, where the oxygen was inadequate for the patients who were being admitted, where the space in hospitals was not enough, and the number of patients went into the private sector where they were being overcharged by our health workers, and so forth and so forth. So the question is, were we prepared for the second wave? And the answer is yes, we had done what was possible to prepare. But because of mainly the new type of the virus, which we never predicted would come, I think we reached a point where the challenge was quite enormous, that the infections were overwhelming what was available. For instance, when you talk on the issue of oxygen, we had increased the oxygen plants in Mulago from 1 to 4. So we had prepared. But again, because of the new variant and its dynamics, the patients were many more compared to what we had prepared. Thankfully, when we now took measures, including the new lockdown, I think Ugandans again have complied, and we are seeing a positive trend. But also to add, that in the first wave, I think government took proactive steps. For instance, we had to provide money for a number of interventions. You know, we had supplementary budgets passed in Parliament. We had statutory instruments drawn and presented in Parliament in order to manage the pandemic and address the lockdown measures, but also address the issues of elections in the political parties. And we recruited additional healthcare workers in our hospitals. We intensified communication and giving messages to our members of the public. We constituted a national task force, which is comprised of many sectors, because we use the multi-sector approach to addressing this challenge of COVID-19, even when primarily it's a disease, but we feel all of us must participate. And that's why government is in the task force, civil society is represented, political parties, including opposition political parties, are represented. So when my brother Davis Rubongoya criticizes what has been done, I just need to remind him that the opposition parties that constitute IPOD and those who are in Parliament are represented not only on the national task force, but also the district task forces. And that's where the decisions which are driving the management of this pandemic are derived from. So the opposition is part and parcel of these decisions that the government has taken to manage the COVID-19 pandemic. Let me thank Ugandans that when the president announced a lockdown and a string of measures during this second wave, again, in my view, Ugandans have complied. And even these arguments of COVID-19 being a political issue or using it for suppressing the rights and the privileges of Ugandans like opposition or using it to steal money, I think we're down because people saw that everybody was getting affected by this ruthless second wave of COVID-19. And like you had the Minister of Health announcing yesterday, we have seen reasonable progress in terms of infections coming down. And on Saturday this week, the president shall be addressing the country on how we are going to transit from these 42 days into the next period. And he will be guided by the science of the virus and also the epidemiological trends. And again, to emphasize that when the president gives directives, he is not merely speaking as President Yoweri Museveni, but there is a process that precedes the presidential announcements. Like as we speak now, the National Task Force is sitting where I'm supposed to be seated and participating, but I chose to first attend this meeting. We have a team of scientists, an advisory committee of distinguished scientists who study the trends, and they make a report to this National Task Force, which, like I have said, is constituted of many actors, government, private sector, civil society, political parties, and everybody. And then the decision is taken, what informs the president's addresses to the country. So whatever directives the president comes out with are backed by science, and we shouldn't just merely see them through political lenses, but they are measures aimed at helping all of us manage this pandemic. So are we ready going forward? Yes, I am sure Ugandans know that since the beginning of the new government, we have by and large been discussing issues of managing COVID-19. And for instance, we have reviewed the budget and suppressed the sector budgets by 40% so that we relocate the money to address the critical areas of managing the COVID-19 pandemic. We have put money to increase on availability of oxygen in our health facilities from Morago Hospital and the other national tertiary institutions, health institutions, down to Health Center 4s and Health Center 3s. And as you have heard, we are going even to change from the kind of technology we have been using of oxygen plants now to upgrade to what we call medical oxygen, particularly the liquid or cryogenic oxygen, which is even of better quality than the other forms of technologies we have been using. We have also put money to buy more ICU beds. It is not true that the beds that we had at the beginning of the pandemic are the same number that we have been having. We've been increasing, only that, like I said, we reached a point where, because of the rapid spread of the new infections, they outmatched the resources which were available, but that has been contained. You also know we are recruiting additional health workers who will be posted not only in the top hospitals, but also the lower level health centers in order to increase our human resource capacity to manage not only COVID-19, but the other disease challenges. And also,
we have about 4 minutes for you to conclude, sir.
Why have you used my time? Okay, let me just get started. We've also put money to buy vaccines because, as we all know, that this issue of lockdown and the other preventive measures are temporary. What will eventually assist us to manage this pandemic is if we vaccinate a critical mass of Ugandans in order for us to achieve what we call herd immunity. Herd immunity means you vaccinate up to around 80% of the population, and then you are able to cover the whole population against new infections. The challenge with the vaccines has not been money, like I have said severally on many media platforms. We allocated 560 billion shillings in the current budget to purchase vaccines. But the problem has been the supply-demand dynamics when it comes to these vaccines, to the extent that even when you have money as a country, it is not easy to just go and buy vaccines. We have to rely on the COVID facility, which is an arrangement of WHO and other UN agencies through which you can access vaccines. We have also placed orders through the African Union. Yes, we are targeting to vaccinate up to 22 million Ugandans. So far, we have vaccinated around 1 million. We think that is too small, even from a public health standpoint. But hopefully, with the orders which we have placed, and also the engagements which we have initiated with the manufacturers and countries, in the coming months of August, September, October, and thereabouts, we should be able to get in many more doses of the different types of vaccines. And then we shall roll out a mass program to vaccinate Ugandans. And that will help us to gradually open up the space to allow schools get open and we return into normal life. But before we have vaccinated many Ugandans, I am afraid we shall start gradually opening up space, but we may not just open fully because we may get a third wave and other waves. But the appeal we make to Ugandans, continue observing the SOPs in the public and wearing with water where you can, and also and crowds which that can transmit or facilitate of this COVID-19. As I wind up, let me raise it in this discussion. So the answer is yes, we are ready. If all of us religiously comply with these measures, then we should be able to continue to suppress the infection rates, and then we may avoid the third wave, which is hitting other countries. So let us all take this issue seriously Let's observe these measures. Don't wait for police or the military to tell you to put on a mask or not to go where you shouldn't go. And then we get in vaccines, and then we should. Let me quickly respond. The budget, we have put more resources, but the comments are correct that we should dedicate more resources towards healthcare and health ministry, and particularly to managing the pandemic. I agree with that, and we are doing that as a government. Public debt, all governments all over, even us individuals at the personal level, we borrow. I think the most important question should be the money that the government is borrowing. Is it being used correctly? Is it being used to deliver services to Ugandans? That's where you should question us. But borrowing, I think is okay, provided the money is put to good use. Has the money been stolen? Bring the evidence. You see, when the Auditor General audits the expenditures of government, he makes a report. That report is taken to Parliament. Then it is examined by the Public Accounts Committee, which is chaired by the opposition. Then the Public Accounts Committee makes a report to the plenary session of Parliament with recommendations, and then we take action. We are not a lawless country that simply because the report has said this. So let's follow the process. And I'm answering my friend Davis Rubongoya that you tell your chairperson of the Committee or Public Accounts Committee in Parliament to prioritize consideration of that report from the Auditor General. If there are people who have misused government resources, we shall definitely, as government, take decisive action. So we don't want to usurp the powers of the Committee of Parliament and Parliament. Let's be systematic, because government of NRM does not condone corruption, and all the money that we allocate for different services must be used to do that work. And if anybody, irrespective of who you are, if you misuse the government resources, definitely we shall use the law to handle you and cause discipline within the country. The Nabanja money, I think there has been a deliberate attempt to distort what this money was meant for. This money was not meant to address poverty alleviation in the north or among the Batwa or those vulnerable groups. We have explained for the umpteenth time that this money was meant to support families, particularly those which live in urban areas, the major urban areas, that got affected by the pronouncements of the president. Because of the restrictions, they were not able to get daily incomes, and yet they survive on daily income, like those taxi touts, taxi drivers, border riders, shoe shiners, that category of the people. And through the data and statistics from Uganda'S and the offices, we estimated around 500,000 families, not individuals. The people who are receiving the money are receiving on behalf of a family. And from Uganda'S, the family size was estimated at about 5 people. So when you talk of 500,000 people, you are talking families, you are talking of 2.5 million people expected to receive. And from the information we have, majority of those who were recorded by the town clerks and LOCs have received this money. Whether there is a bigger section of Ugandans who were left out through that registration, that can be discussed. But for those who were registered by town clerks and LOCs, majority of them have got the money. The few who haven't got are those who had challenges with the registration. You find somebody has a NIN, national identification number, that doesn't match the telephone number, or a telephone number has been registered by 3 or 4 people, the same number, and that is being sorted out. But the majority, over 80% of those who were registered, have already got the money. So it was also important, the person who made a comment that we should put the money on vaccines, not on relief. Relief is equally important, but also vaccines are equally important. And therefore, I think it was correct to support those families. And the reason why we are not supporting other people in the villages, we think, yes, every Ugandan has been affected by these measures, but there are those people outside in the countryside who can still access food. They may have challenges, they have no money in the pocket, but they can get their gardens and get food. So we're just responding to those in urban areas who were gravely affected by these lockdown measures. We thank you very much. We received the recommendations from the report positively. We take them in good faith. I have a copy of the report, and after this meeting, I am rushing to the meeting of the National Task Force, and given an opportunity, I will present some of these observations so that we incorporate them in the discussions of the task force. The military, it is not true that we have militarized the response, but in order to enforce some of these measures, there was a need for our security officers to be deployed to ensure that there is compliance. We regret any irregular activities or misdeeds by particular individuals, and if we get information, we shall punish those security officers who abuse their authority. It is not meant to beat anybody or to abuse anybody, but to ensure that we comply, because there are also sections of Ugandans who will want to defy whatever has been announced. The involvement of police and security officers is to ensure total compliance to these measures so that you and I can be protected against this deadly COVID-19. But like I said, this is a new disease. It brings challenges. We continue to learn, and we appreciate all the comments which are being given, and we shall continue to improve as a government and as a people of Uganda so that we can get out of this COVID-19 alive. I thank you very much and wish everybody very fruitful deliberations.
Thank you very much, Honorable, first for accepting to come on short notice, and apologies for giving you a short time because you are addressing issues with a lot of eloquence you are known for. At the moment, I see an interesting message here. Do you think, from Mary Immaculate Anyango, do you think it's impossible to it is possible to vaccinate all Ugandans because most people will just refuse? Possibly she's trying to talk about the issues of the ignorance around the vaccine and the low information, a lot of false information, how to counter that. But I would request that you stay around, Honorable, for a few minutes. We'll give you some 3 minutes to give closing remarks.
Yes, I'm still around.
At the moment, I request the participants, we shall take 5 questions from the participants, and then we invite the presenters to respond. And if we have time, then we shall invite another set. But I request the main presenters, please, to stay around for a few minutes, just to respond and give the last word. Thank you. So we have opened the floor for participants. You can raise your hand and we give you an opportunity, please. Yeah.
What we're going to do is just raise your hand, then I will unmute you and let you make your submission. Let's start with Okwari James. Okwari James, go ahead. Okwari James,
yes, this is Okwari James. Are you getting me?
Yes, we are getting you.
I'm good to go, eh?
Yes.
Okay, good afternoon to everyone that has been part of the participatory group, and thanks for bringing this policy and this opportunity to engage the stakeholders. And
please go straight to your comment or question because of time.
James, we've lost you. We've lost you. Let me have Benjamin Jamuhaba. Benjamin. Go straight to your point. If you're having poor network, really low. Nsega Steven, unmute. Nsega Stephen. We're having network issues. Let me have Twekembe Easton. Twekembe Easton.
Thank you, Marvin and other presenters. My name is Twekembe Easton. My question goes to the Right Honorable Minister of ICT. You realize, as we are in our villages and we are studying online, it is really challenging because you find when we have many lectures in a day, and in villages, network issues and also data are becoming a challenge to us, and also necessary ICT infrastructure. So I would request that in their meeting, they talk about how they can facilitate, how they can help us with data, and also maybe if they can have a plan of providing all university students with laptops, enhance e-learning, it would work for us.
Thank you, Easton. Ibrahim Biamukama. Ibrahim Biamukama. Go ahead to the question.
Okay, thank you, moderator. Okay, in my view, for the speakers that have been speaking, of the 1 million and plus.
No, you're breaking. Mugenyi Nathan. We're going to just take those ones that are very clear for the interest of time. Mugenyi Nathan. Nwagaba Derek. Nwagaba Derek. Sebunya Isaac.
Thank you so much.
Go ahead.
Good. Thank you so much. My question goes to what the minister said immediately, that in these coming months, he said the coming 3 months, they are aiming at getting very many vaccines to vaccinate maybe the number they are targeting are 22 million. But he mentioned something like getting these different kinds of vaccines. And that thing is starting from the start, even from the last speech of the president, that they're using different vaccines. And to me, to my opinion, before we talk about being ignorant about vaccinations and what, those of who know some little information about the medical bit, for me, I don't feel very safe actually when I hear that word, that different vaccines to maybe, are we acting like maybe testing, or they are still testing whether they will be working on us? Why is it that maybe if they use the AstraZeneca, maybe they use that vaccine, but what's the implication?
Thank you, Isaac. Your point has been gotten. Let me have Teopista.
Okay, thank you so much, Marvin, and thank you, the minister. Mine, given that the minister says that he's going to meet the task force, my advice would be that it would really be important if we did a risk analysis and had a risk plan in place when we are about to pronounce a lockdown. If you look back at what happened the other time, where we saw a lot of firefighting and reactive approaches when children got back from school and they were all stuck, we were reacting instead of being proactive. So going forward, definitely the task force, the Ministry of Health and all the other people knew that they were going to get us into a lockdown. So before the president pronounced, we would have done a risk analysis and had mitigation measures to try and address those issues, because we don't know the number of people who got infected by just that scandal that happened of people looking for buses and all that. So that's why.
Yes, thank you, Teopista. Let me have Nashiba Nakavira. Shall I have one more?
Okay, thank you so much, Minister. My question is, how will I even know that the vaccine is genuine? Because I watched news last time, and the claims that some of the vaccines on the market are not genuine. And also the fact that, I don't know if it is just a misconception, that when you receive a jab when you are already infected, you die. What is the government doing about those perceptions? Thank you.
Thank you, Nashiba. Lastly, let me have Rachel Cassidy. And you. Your network is very poor. Let me give Innocent. Innocent, go ahead. Innocent, I write it.
Thank
Innocent, Innocent.
Thank you, ma'am. Thank you, Minister. My question is
My name too.
The networks are very poor. Let's get back to the minister.
Yeah, thank you very much. Whoever has managed to speak, we really apologize for the bad network, and we hope next time you find a better location for better network. Let's give, first of all, the opportunity to other presenters to make the last word in terms of protocol, and then we can give the minister to respond to the issues raised. I invite Mr. Jude to make the last word. Mr. Jude Remisista, are you there?
I'm there, thank you.
Mr. Jude, we can hear you.
Thank you very
We can
much,
hear you now.
Doctor. Thank you very much, Dr. Werike. Yes, I'm there. I can only say that the comments from the last two, there was no comment directed towards me, but the last two comments, I think, addressing issues, myths and misconception of healthcare messaging, emphasized the point I was making about health communication. That even at this level, there are people who still need basic information, and that speaks to the strategy to communicate. We need to review the communication and the messaging. There's a lot of misconception of the healthcare messaging in the pandemic. I thank you. I'd like to let the presenters compile, respond to the questions addressed to them. Thank you very much.
Yeah, thank you very much, Jude. I have also been informed that the Secretary General Noob has left because of other engagements. I now take the opportunity to invite the Honorable Minister of Communication and National Guidance to respond to the issues that have been directed to him. And then thereafter, we shall have closing remarks from the Executive Director of the Afri Leadership Institute. Thank you. You're welcome, Honorable.
Oh, thank you very much, Gerard. And let me thank all those who continue to participate, and also thank those who have been able to make comments and raise questions. What I noticed immediately, the minister responsible for IT, as Eston asked, I think there is a challenge of network and connectivity in the countryside. And right now on my desk, I was just reviewing the proposal that I am going to present in the cabinet, either on Monday if I get space, or the other Monday, on a new project to expand the connectivity in this country to all corners. So we are going to lay optic fiber cables as part of the 5th phase of the national backbone infrastructure, so that we are able to have access to internet and digital infrastructure in all parts of the country. So the first question by Pekambe Eston is right. And also he raised the issue of the need to facilitate learners, starting from university students and even other learners with the laptops or computers, This also is part of our plans as the Ministry for ICT, because we've been challenged by this COVID-19 pandemic, where our students are now at home, and those especially who are in the countryside are not able to participate in e-learning, and therefore that is really a lot of work for us, which we are already handling, and we hope resources getting available from government, we should be able to address those concerns. Now, I think there was a positive comment that before we make pronouncements, like the president is going to do on Saturday, we do a risk analysis and look at mitigation measures. And she gave an example of last time when we said our children go back to school because the COVID had invaded the schools. We didn't manage the issue of transporting the students back to the villages. And I agree with her. And we regret what happened because some of the students were infected and they crowded in the bus parks and they went to the villages. I think arrangements were not made properly to have them tested, and I feel they infected their parents, and this also contributed to the spread that we saw in this second wave. So I think she's right that let's learn from the past lessons and then be able to do things better as we move forward. So I take that comment positively, and it's very important, and I will share it in the task force to see that we prepare much better than we have done in the past. Nashiba was asking about whether these vaccines are genuine. No, Isaac first. Isaac Sebunya said, when I said we are going to bring in different vaccines, he gets worried. Now, we now have about 23 vaccines on the global market which have been approved for use among human beings. We've been using AstraZeneca as a vaccine, but there are other vaccines. First of all, there is a process that these developers of vaccines go through before their vaccines have been approved and allowed to be used on us as people. And there is AstraZeneca, is just one of them. There is Johnson & Johnson, which was manufactured in America, developed in America. There is Pfizer, also from America. There is Moderna. There is Sputnik from Russia, and many others. So what we've done as a team of scientists coordinated by Ministry of Health, we have approved particular vaccines which we shall bring in, especially based on costs. First of all the vaccines which have been approved for use are safe and efficacious and effective. So they are effective and they are safe. But the other things we have been looking at are issues of cost, because they cost differently, and in resource poor settings, if we have to buy many doses, we also have to look at how much do they cost. So like now we shall continue to bring in AstraZeneca, but we shall also add on Johnson & Johnson, where actually we give only one dose, one injection instead of two like the others. We shall also bring in Pfizer. It's first coming in as a donation. So we shall now have, because if we just insist on using only one type, then we shall take a long time to get enough doses, because there is an issue of supply. So you shouldn't get worried. We cannot bring in vaccines whose efficacy or whose safety is doubted. In any case, they will not have been approved by WHO and the other approving authorities. So you should not get worried. So bringing in different vaccines means, in addition to AstraZeneca, we also bring in other types, like the one from China, Sinovac is also okay, and the Pfizer and Johnson & Johnson. So we shall have now a multiplicity of different vaccines which are equally safe and equally effective, so that we can vaccinate as many Ugandans as we can. Madam Nashiba was again asking, how shall we know that the vaccines we are bringing are genuine? Government cares for its people. We cannot bring in a vaccine which is not safe for Ugandans. So we want to assure you that the concern you have is the same concern I have. I have children. I wouldn't want my children to be given a vaccine which will kill them. So the vaccines we are bringing in are safe and they go through a rigorous and robust process in order for them to be approved by the authorities, especially WHO and the other approving authorities. So you should not get worried. Yes, there was a report of people who received wrong vaccine. Others were saying water. Again, these are unscrupulous Ugandans who want to make money. The Ministry of Health was announcing that we have accredited health facilities where we are giving the vaccines, and the vaccines are free. But some Ugandans decided to open their own centers and started charging people. So why should you go to a place which is not accredited by government, and then you pay money when the government is saying the COVID vaccine is free? So they were just conning Ugandans, and they injected them with water. We continue to investigate. We shall arrest those who were involved, but we again appeal to Ugandans that if Ministry of Health has announced that the vaccines are here, why don't you go and get? Why do you want to cut corners? So you just give a chance to idiots who want to just make money to now start conning Ugandans, and that should stop. There are misconceptions and myths and rumors and falsehoods. Yes, we need to strengthen communication, because like she said, there is a falsehood that when you have been infected with COVID-19, if you get injected with the vaccine, you die. That's not true. Actually, we recommend that even when you have suffered from COVID-19, you are still eligible to receive immunization or vaccination. Why? Because when you get a vaccine, their immunity will even further be boosted. So the vaccination will be like a booster injection, because when you get infected, you amount some immunity. But when you get injected with a vaccine, your immunity even becomes stronger. So even those who have had infection, they also get vaccinated, and it is okay, and there is no negative effect or anything wrong that will happen to you. I think drawing from this discussion, that one, I want to thank the team that put together this policy paper that has stimulated this discussion. And like I said earlier on, this is a disease which is affecting all of us. It should not be an opportunity for us to politic. Let's all look at where we are and see what contribution we can make so that Uganda can get out of this disease. And I want to urge my colleagues in the opposition that you bring positive proposals. Instead of concentrating on criticizing what the government has not done well, bring proposals so that together we can build this country. Time for politicking will come, but for now, let's all put our heads together. Missions have done to compile and put together this report, which definitely will inform what we are doing as a national task force, as a government, to improve the way things are being done. And like I said earlier on, we receive warmly the recommendations from this report and what has come out of this discussion, and we shall ensure that we integrate all these issues in the national planning so that we can have a better national response against COVID-19. We continue to call upon Ugandans to respect the measures, simple as they may appear, inconveniencing as they may appear, but let us continue to wash hands with soap and water. Let's sanitize. Let's put on masks when we're in public and put them on correctly. Even when the president announces measures which will ease some of the restrictions, let's continue following the SOPs. Even when you have been vaccinated against this COVID-19, we still encourage you and request you to follow these measures, like putting on masks. And from government, we shall do whatever it takes to protect Ugandans. Particularly, we are going to ensure that we work around the clock to get the vaccines into the country. And we really ask everybody to pass on this message that one, the vaccines are safe. Two, they are effective, particularly effective against getting severe disease, getting hospitalized, and death. When you are vaccinated, you may still get infected, but the infection is not likely to be severe or critical, and you are not likely to get hospitalized. You are likely to be asymptomatic or have mild disease, and therefore let's embrace the program of vaccination. We shall ensure that we vaccinate many Ugandans, and that will help us to open up fully so that we return to normal life the way we see it in some European countries and the Western world, where over 60% of their populations have been vaccinated. Thank you very much once again, and I am happy to have been invited to be part of this discussion.
Thank you very much, Honorable Dr. Chris Baryomunsi, for those insightful views. I think you have addressed a number of things, and we thank you for your commitment to take everything positively and inform our government. We look forward to having another engagement with you. There are so many, but unfortunately, because of time, we are not able to relay all of them, but we shall print them and be able to share probably by email. I thank participants, Medad Asimwe,
yes,
Becca Godfrey, Sega Steven, Ankunda Liz, Tumwesijire, Tony Bawebie, Medad Asimwe, so many, Nwagmanya Innocent. We shall address this issue and direct them to the policy makers. At the moment, I'd like to invite the Executive Director of the Africa Leadership Institute, Honorable David Poolcall, to give us a vote of thanks and then make closing remarks. Thank you very much.
Thank you. Are you hearing me? Are you
yes,
hearing me?
we are hearing you.
Excellent. Thank you very much, Mr. Minister, and also, of course, in absentia, our colleagues from NUP, fellow citizens, Africa Leadership Institute treasures three things. One, that's why we are doing this: access to information in the custody of government or government agencies as a fundamental right for citizens of Uganda. That is a constitutional right. And that's why we organize meetings like this, so that, and then we bring the decision makers. Honorable Minister, we are so happy. I think you're well placed. And also the colleagues who have been elected in Parliament. So today was to bring cabinet and the opposition who give alternative policies, and then the academia, Uganda Management Institute. Now, of course, access to information as a fundamental right. And that's why today there were over 1,000 participants. And we realized that the 2 rooms we had provided were not adequate. That's why we had to divert other traffic to YouTube, to Facebook, to others are getting it through Twitter. So we thank you so much, because we want this message to reach out to many. Now, I apologize, I came late because I went for my second dose. And I definitely want to encourage all citizens, if you get a chance, the opportunity to, please do not listen to these rumors that are too many in the social media, and you find yourself under fear. It's about your life, it's about the life of your dear ones, and you have no reason to lose your life just out of your own carelessness, your own choice of refusing to heed. You've seen the president being vaccinated. You've seen the leaders of government. You've seen the first lady. You've seen the leaders in the army. Even Dr. Gerald, you see there, has already taken his second dose. So many of us, and therefore the message I want to give across is that when you get the opportunity, please do not waste opportunity. Just go and get it. That is my message. The second thing we treasure is that under Article 38, clause 1 and 2 of the Constitution of Uganda, it says citizens have a right to peacefully influence the decisions and actions or policies of their government, either through their elected representatives or through their civic associations. That's clause 2, like CSOs. So we know that all power belongs to citizens, and that power is delegated to the executive when you elect a president. And therefore, when he appoints ministers and judges, and it's like you citizens are the ones who have appointed ministers or judges or army commander or police chiefs, because he's doing it on your behalf. So let's respect those that have been given a chance to serve the country. Secondly, that delegated power to Parliament. And therefore, when Parliament take decisions, they take it on our behalf. And that's why we don't want to leave them alone. We must continue to peacefully engage like now. Nobody is tear gas, nobody is throwing anything, you've been so civil in your communication. That's what we encourage. Engagement between citizens and their leaders, and the leaders to become more responsive. So we want to achieve three things. One, increase participation of citizens. Two, improve accountability, improve responsiveness of those who are in leadership. So that's why after this, we're going to print all your comments and the numbers and names of you who have participated and put in a report. We're going to send it to the minister to show the kind of level of engagement that has taken place here, so that even those of you who are not able to ask questions, your questions or comments are in the chat room. So all those will be printed and be part of the annex of the report. Also, this will be given to the leader in the opposition. So we appreciate. The third thing we want is, when we do research like this and bring citizens, it is now for you citizens to use the information to engage those in leadership. That's why you don't see us as speakers. So that's why when we bring a scorecard, we give it to you. It's up to you to use it to engage your leaders. So we thank you very much. And therefore, we encourage the uptake. You put proposals there. It is now cabinet to choose. Fortunately, Mr. Minister, in preparing this, we are working together with the Cabinet Secretariat, which is in partnership with Uganda Management Institute and then Africa Leadership Institute. Our role is to bring, even now as we speak here, 15 radios throughout Uganda are listening, and they are recording this discussion, and they are going to air out in whatever used to be a district in Uganda during independence, or whatever was a kingdom. So we picked at least one FM radio station which we partner with. So this information is being relayed wide, and that's why we thank you for coming. As the population takes this information you have given, we now ask you to take this information to cabinet. Pick and choose what you think is very good, and we also give those in opposition to use this information to frame their questions to the Prime Minister, to the respective ministers, to raise matters of national concern, or even to originate a private member's bill. So we thank you, and thank you participants, and I thank all of you. I thank you, Dr. Gerald. I thank you, Mr. Jude, and send our best regards to UMI Director General and his team. And we thank all of you wherever you are. Mr. Minister, you will see from the attendance that all regions, sub-regions of Uganda have registered here, are participating. So please come again, and may God bless you and travel safely, and see you again soon. We will be organizing another one, either on COVID-19 and education institutions. There's also a policy on that. There's also a policy on tourism. There's a policy on disaster management. So we have a number of policies, but the time is not enough. And Mr. Minister, we are subsidizing the MBs, that citizens who are participating here. So after this, we're going to send through Payway. We're going to replace the MBs which they have used for attending an important meeting like this. So maybe you'll now find a way of considering later on, particularly for the students, how the tax on MBs can be reduced to enable those who want to study, who are going to study. But that's a different matter. You will find, Mr. Minister, that a majority of people participating here are between 18 and 30 years. So you're really most welcome, and God bless you and bless you more. Thank you.
Thank you, Honorable Kulkol, and thank you, Minister. Let me just recognize those who are in room 2. we had those in room 1, but room 2 also was packed to capacity. Some of them included Derek and so forth, but it's okay. Let's stop there because of time. It's now 1:10. So we thank you and have a good day. This was brought to you by Africa Leadership Institute as a public policy think tank for Uganda and the region. Thank you very much and have a blessed day.
Thank you very much. Thank you.